Have you been breathing through your mouth more lately? Do you feel like your nose is always blocked? Are smells not as strong as they used to be? If you answered yes to any of these, nasal polyps might be the cause. These are soft, painless growths inside the nose or sinuses. They are usually not cancer, but they can make life hard. The good news, some home steps can help ease symptoms and may make polyps smaller. Below I explain simple, safe things you can try. I also tell you what really works and when to see a doctor, what are nasal polyps and why they form. Nasal polyps grow when the lining of the nose stays swollen for a long time. This can happen with chronic sinus inflammation, allergies, asthma, or aspirin sensitivity. Small polyps may cause no trouble. Big ones can block the nose. They can reduce your sense of smell. They can cause a runny nose or pressure in your face. Common treatments from doctors include steroid nasal sprays, short courses of steroid pills, and in some cases surgery. But many people want home-based ways to feel better first. What works at home? The short list. Here are safe, low-risk steps that may help. Saline nasal irrigation, rinsing the nose with salt water. Steam inhalation, breathing warm, moist air. Budesonide, steroid, nasal rinses, used with a doctor's advice and prescription. Anti-inflammatory foods and supplements like turmeric, curcumin, limited evidence. Avoid triggers, control allergies, smoke, and strong irritants. Good sleep and hydration, simple things that help healing. I'll explain how to try each one safely. I will also point out which approaches have stronger proof and which are more experimental. Saline nasal irrigation. Simple and backed by studies, rinsing the nose with a large volume saline wash, a neti pot or squeeze bottle, helps clear mucus. It also washes away irritants and reduces swelling. Multiple studies and clinical guidelines say nasal irrigation is helpful for chronic sinus symptoms and can ease breathing. It is low risk when done with clean water and salt. Use sterile, distilled, or previously boiled water. Mix with the right amount of salt. Ready-made packets are easiest. Do not use tap water straight from the tap. How to do it? Lean over a sink. Pour the saline into one nostril and let it drain from the other. Breathe through your mouth. Repeat once or twice a day when symptoms are bad. Steam and inhaled vapors, symptom relief, not cure. Breathing warm steam can loosen mucus. This may make your nose feel clearer. Some people add a few drops of eucalyptus or peppermint oil to the steam. That can give a pleasant cooling sensation. But these oils do not actually shrink polyps. They can help you feel better for a while. Also, essential oils can irritate some noses or skin. Use them sparingly and never put undiluted oil directly into the nose. How to do it safely. Boil water, pour into a bowl, let it cool a little. Put a towel over your head and inhale the steam for 5 to 10 minutes. Keep your eyes closed. Stop if it feels too hot or causes irritation. Nasal steroid rinses, budesonide, effective, but talk to your doctor. Topical steroid sprays are the main medical treatment. For some people, adding steroid to a saline rinse, budesonide rinse, can reach the sinuses better than a spray alone. Clinical trials show that steroid rinses can reduce inflammation and improve symptoms for people with nasal polyps. However, you should only do this under the guidance of a doctor. Steroids, even local ones, carry risks if used long-term or incorrectly. Turmeric, curcumin, and other anti-inflammatory supplements, promising but limited. Turmeric curcumin has anti-inflammatory properties. Small studies suggest curcumin might improve nasal symptoms in allergic patients and could affect inflammation. But evidence for shrinking nasal polyps specifically is limited. Some research on curcumin and intestinal polyps shows benefit in different conditions, but these results don't directly prove it works for nasal polyps. If you try curcumin, discuss it with your doctor, especially if you take blood thinners or other medicines. How to use. Consider a standardized curcumin supplement as directed on the label. Use food sources too. Turmeric in cooking is safe and adds flavor. Allergy control and lifestyle steps, small changes, big effect. If allergies or asthma cause your nasal inflammation, controlling them helps reduce polyp growth. Here's what to do. Use allergy-proof bedding and wash it often. Keep indoor air clean, avoid smoke and strong chemicals. Manage asthma or reflux if you have them, stay hydrated and get enough sleep. These actions lower the everyday triggers that feed inflammation. Over time, they can lower the chance polyps grow back. What to avoid: do not try unproven home surgery or pushing on polyps. Avoid using unclean water in irrigation. Be careful mixing essential oils with children or pets in the home. Don't stop prescribed medicines without asking your doctor. When to see a doctor: don't delay if things worsen. Home care can help mild cases, but you must see a doctor if you have trouble breathing, high fever, severe facial pain or swelling, sudden loss of smell or vision changes, symptoms that last more than 12 weeks. Doctors can examine you, confirm polyps, and suggest stronger treatments like medical steroids, biologic medicines, or surgery if needed. Polyps often come back, so long-term follow-up is common. Final tips: a simple plan to try at home. Start a daily saline rinse. Use steam 1 to 2 times a day for relief. Avoid smoke, dust, and strong smells. Talk with your doctor about steroid rinses or trials of supplements. If symptoms are severe or not improving, seek medical care. Nasal polyps can be frustrating. You can try safe home steps that ease symptoms. Saline irrigation and steam are the most reliable at-home helpers. Some natural options like turmeric show early promise but need more proof. Always use clean water and follow safety steps. And if breathing or smell gets worse, see a doctor right away. Treating the inflammation is the heart of the solution, and that often means combining home care with medical advice.